During internship, a bit of confidence which I lack in my final year, like how to manage a patient, especially in RHC when you be in night duty, so you and your co-intern will be there. So that's like more exciting and that more feels like you are a doctor.
Okay, that's a very complicated question. I guess the ability to get through a lot of difficult situations mentally and the ability to work out for more than 6 hours continuously because third year and final year made me too lazy physically. But then I gained a lot of friends in seniors, JS and all that. I think that's important.
What did you gain? Mostly time management skills, I think. How to manage your personal life as well as your professional life. Till now we were just kids, no, nobody just like we didn't have anything like that. We used to go to class, come back and chill. But now you actually understand that how to leave things at the hospital in hospital and come back to be yourself. That's what I learned in internship.
During my internship, I gained a lot of experience. I got to learn from some of the most dedicated JS. Then I was able to communicate more with the patients and got to know each of them. So that's it.
See, internship is a part when you interact with a lot of people, interact with patients, interact with your seniors, interact with your juniors also when they are coming from work clerk. So you gain interaction skills, you gain leadership skills, and also you gain some clever crooked skills, how you can skip, how you can escape. Everything forms a part of internship. So it's not just your medical skill improve, your life hacks you get. You earn a lot of life hacks in internship. That's it.
What did I gain? Like honestly saying, I don't know. Maybe after 5 or 10 years I'll realize what I gained. As of now, I don't know. Something and all. I don't know actually, like, because most of the work we do here is like DRLs only. So I don't know. Maybe after 2 years, maybe when you ask me the same thing, maybe then I'll be like, I gained so much insight or something. As of now, nothing.
I've gained not so many, but a little bit of clinical skills, and then how to interact with patients mainly. Basically, in theory, and even during our postings, we like basically from my side, I used to go take case, do examination part, and then come back. But rather than knowing, apart from knowing the theory part, we were never exposed to the practical aspects of treating and how people live in ward and all. So I think I'm like I got so much exposure to these things, especially in surgery and all. I'm in S2, so my JR is especially taking rounds with interns. So he'll be discussing his plans. He'll be like, okay, so and so antibiotics are going on. We have started this. We are going to do this and so these many investigations for so and so. Like we need to know about so and so things. So like I feel like we are more involved into the treatment process. Like so that's what I liked.
What did I gain by internship? Some tricky question. Is it started? Has it started? A lot of experience, exposure to the patients, and more like in affection towards patients that I have developed. That it was not there throughout my MBBS life. I have learned more about the patient care. Enough,
To be honest, I gained not just clinical knowledge, but I also gained like how to manage things with seniors, because as a medical professional we have to deal with a lot of people in our life. So we have to know that how to deal with them, how to get many works done, how to request people, how to talk, and most important is that communication with patients. That's the best thing I learned during internship, how to communicate with patients, how to break some news, how to even convince them to take blood sample, which seems a very simple thing, but it's really a challenging task. If you take every day and suck the blood out of them, it feels very challenging. But this, you can say that this is a learning step towards breaking bad news, telling huge things to the patients, which is a very great deal I think I gained out of internship.
Uh, there's a lot of practical things I learned, like how to deal with people, practical skills, like related to clinical as well as human relations related. Maybe academically not that much, still final year, but practical aspects definitely yes.
Experience, like working, like in taking samples. Like in some patients it's difficult, some patients it's easy. Like even if the sisters are not there, we'll be able to take samples in some low facility setting. That's all. Pain.
Okay, basically it was just sampling in most, like in many departments, but I got to learn many things. Yeah.
Me, uh, how to manage myself, how to interact, how to manage stress, I mean, how to balance work and life, how to keep in touch with people who matter, how to maintain proper relationships with people in the sense the workspace environment, stuff like that.
I gained a lot of self-confidence, how to deal with people, and yeah, that's what I gained mostly.
Yeah, it was a new experience during internship. We had to take responsibility, and we have to learn how to cope up with colleagues of various mentalities, and uh, and also being with patient, and and also learning different things, like keeping a hat of different department JRs. I mean, knowing their views in each department so that we can have a better choice for our own PG. So these are the few of the points which I gained.
Basically, I gained a lot of practical experiences which I didn't get during my UG times. Like most of the practical skills we were not led to do during our UG time, that I got to do during the internship. Other than that, learning as in theoretical wise, patient management wise, I haven't gained much, I feel.
Money. To be honest, got a lot of practical skills, but like proper patient care wise, it is less. Other than that, usual thing only, like the normal doctor patient stuff.